Welcome to the second part of the lifestyle segment. Mental health remains a critical but often overlooked issue in Nigeria, with many struggling to find credible support. Today we're joined by Deborah Omage, who is a programs associate from Nigerian Mental Health, to discuss the groundbreaking launch of the country's first in-person mental health rehabilitation centers directory. Good morning.
Good morning.
It's nice to have you here on the show, Deborah.
Thank you. Nice to be
And
here.
it's Mental Health Awareness Month, so it's timely. The conversation is timely. Can you tell us what inspired the creation of this mental health and rehabilitation centers directory?
Okay, so earlier in the year, an actress reached out. She put out a cry on social media, asking for help with regards to someone that needed it. And Nigerian Mental Health was tagged on that post a couple of times, which is a testament to the work that we do. Now, in as much as we had helplines that we could provide, we needed in-person centers that she could go to or check the person into. And then we realized that it was lacking. There was no verifiable place that we could say, okay, yes, you can go here or go there. And that was the primary inspiration for which we did this work. Also, not everyone wants online support. Some people want in-person support. That's another reason why we put together the directory.
Okay.
Yes.
Why do you think this is a significant achievement when it comes to mental health in Nigeria?
Okay. So, in line with passing into law the Mental Health Act of 2022, one key thing was bringing together resources, ensuring visibility when it comes to places where people can get help from. However, it's been lacking in terms of implementation. Hence, we said, you know what? Visibility is access, and silence is fatal. Now, people need to be able to get to places where they can receive help. Knowing that if you look at the statistics by World Health Organization, over 40 million people in Nigeria go through one form of mental health condition or the other, mostly being either depression, anxiety, amongst the others. However, less than 85% of these people, about 85% of them, don't get the help that they need. Hence, the need to put together this directory. And like we said, we had to go through rigorous check-in different months of the year. It took over 3 months period of time to put together the directory, making phone calls here and there, trying to verify, yes, are they on site, the kinds of services that they provide in line, ensuring that they are mental health related.
Yeah, that even leads me to my next question. How has NMH, been able to source and verify these centers that are now in the directory?
So altogether, we have 49 centers there. However,
sorry, does that 49 cover Nigeria, the whole nine? Okay.
Not all of the states,
okay,
but in different parts of the country.
All right.
In putting together the 49 of them, we could only totally verify 17. That is 35% of the entire thing. Why is this? There are certain criteria that we put together in trying to verify this. Now, we had to check, do they have a physical presence? Are they in line with mental health? What kind of services do they provide? Also, think about their digital footprint. Are there places that people can call? Are there places that people can contact one way or the other? So after putting together the list by gathering it from different sources, we started placing calls. We started trying to find out from them, okay, are you here? Are you there? Is this your correct address? Is this your correct contact number? We're told you offer these services. Is it true? Is it correct? Is anything missing from this? Should we add anything to it? So some of them didn't respond to us for a number of reasons, or they were skeptical. Why are you asking this information? What do you want to use this information for? While some others were very much open to it. And this is part of the reasons why we're inviting the public to also give us feedback on it. Okay, you go through it. Are there other places in other states where other centers that are available that we have not added to it? Let us know about it. The directory is currently live on our website at Nigerian Mental Health, under the page Mental Health Support. Now, people can go there, look at it. There's also a feedback form, either to just give general feedback or to submit a center. We're inviting the public, everyone, to do that. Yes.
Okay, so you said 17 have been verified.
Yes.
But all 49 are in directory.
Yes,
What happens if someone goes to an unverified mental health center?
That's why you have to call. The numbers are there. You have to find out before going there in person. And also, that's why we have places for comments and feedback. So if by the time you try reaching out, or let's say, for example, we can't physically be present in all locations. If someone, for example, is, let's say, hypothetically speaking, we put a center in Kaduna State, and we're not there in Kaduna State. If someone should check and say, okay, I don't think this is correct, they could always reach out to us, and then the information will be corrected. Now, this is just the first version, so most definitely we would improve on it with time.
How do you think this directory and access would change, how Nigerians perceive mental health? Because I don't believe we're there yet. So how do you think it's going to, change the view?
Okay, you're very much correct. We're not there yet. However, we're growing. Now, the average Nigerian, when they hear mental health, will equate it to madness.
Yeah.
However, mental health is on a spectrum, okay? There are other conditions, anxiety, depression, mood disorders. There are a number of them. So how this would help is, one, it would serve as a guideline for people. Like I said, some people may be in distress, but they don't know where to go to. So this will serve as a resource. Say, okay, yes. This also complements the helplines that we have on our website as well. Some people would say, I want to remain anonymous. Let me talk over the phone. Others would say, you know what, I think what I'm going through, I would like to see someone physically. So this directory would help serve as a guideline for people. And in terms of improving the state now, stigma is still there. Again, visibility is access. Now, bringing this out, showing people, it will tell them that there's no shame in it. These centers are there. If you need help, the same way when it comes to your physical health, you can walk into a hospital. Same thing when it comes to your mental health. You should not be ashamed. And this is just an outcry saying that mental health is nothing to be ashamed of. The same way you go through a physical condition, you can also go through a mental health condition. And by the time you seek correct help from the right sources, through licensed practitioners, you get better and life goes on.
So what challenges did NMH face in putting this directory together? Were there any?
Yes, there were. One of them specifically is the respondents from the centers that we're trying to reach out to. Them not picking up their calls. Some of them will pick up, but again, they will question us, what do you want to use this information for? And that was the major challenge, basically. Okay. Reaching out to them, asking, okay, yes, is this correct? We just wanted to verify their information, but they were not responsive. Yes.
So looking forward, how does your organization plan to keep this directory up to date, accessible, and just current, basically, for Nigerians?
Again, on the website, it's there at Nigeria Mental Health. All you have to do is scroll to the page Mental Health Support, under which the directory is there. We have a feedback form that is live that will be checked all the time. Now, in that form, we will collect the information of the person submitting a center, as well as the center's information, as should be in the directory, where people can search either by location, by the number of open hours they have, the state which is in, the services that they provide. And when those informations have been submitted to us, all we have to do is call, find out from them. If we have to go beyond calling, then we would. Now, this is also to tie it in line with why we're pushing for the creation of the mental health department under the Federal Ministry of Health. So we can have data systems, so we can have a centralized position in it. So we can have regulatory bodies, quality assurance when it comes to the help that we're putting out for people. And also to just learn more about how you could go about updating the information, or how you could learn about mental health support and care in person or virtually. We're going to be having the launch event on Wednesday, the 28th of May, by 6 p.m. West African time. It's going to be a virtual event, so you could always join us. We're inviting the entire public to actually be there. We're going to have a keynote speaker, Senator Asuko. We're having Banky W on board, Titi Tade from Shopping. We're having the National Mental Health Coordinator and myself as the moderator. So you could sign up for it using our social media handles as Nigeria Mental Health on Facebook, on Twitter, on LinkedIn, on Instagram. All you have to do is check the link in our bio and register. We're hoping to see you there.
Okay,
Thank
so
you.
before we go, could you tell our viewers the exact website to access the directory?
www.atnigeriamentalhealth.com.
Okay,
Yes.
straight to the point.
Thank you.
All right, thank you so much, Deborah, for this enlightenment, and particularly the directory. I'm very sure it's going to help a lot of Nigerians, particularly those that don't know who to turn to or where to turn to.
Yes.
Thank you.
Thank you,
All
too.
right, that's it for the lifestyle segment of the weekend show. Do stay with us. We'll be right back.